name is Macy Nichols, and I am about to give a speech on Japan. Think about how many times you get sick a year. How often do you go to the doctor to get better? Well, the people of Japan go to the doctor 3 times more than Americans because they have cheaper health care. We have a different way of life in America than the people do in Japan. In my speech, I will discuss the Japanese healthcare system and how it affects business in Japan. Before you know about the healthcare and business in Japan, you should know some basic facts about the country Japan. Japan's neighbors are Korea, China, and Russia. The national flag is known as the Hinomaru. Japanese national currency is the yen. The main religions are Shinto, Buddhism, and Christianity. The Emperor of Japan is Akihito, and he is the 125th emperor and came to the throne in 1989. Another way of transportation in Japan is that trains are the best way to get around. They also use airplanes and buses as well to have another way to get around. If you are a student who is going to study abroad in Japan, there are some things that you need to know about studying in Japan. A visa is the most important item you would need if you are studying abroad. If you are a student in the U.S., Japan has a general visa exemption arrangement, and you would just need a valid passport to study abroad. Normally, these last for about 90 days. There are language schools that students can attend that teach students Japanese. They offer various levels of courses that will help students learn the language. When researching about studying abroad in Japan, I found an article called More Young Japanese Heading Abroad to Study by Miki Tankawa, who writes for the New York Times. Miki stated that more students study abroad in the U.S. than in Japan. Statistics from the Institute of International Education state that 47,000 Japanese students were studying abroad in the U.S. in 1997, but in 2011 it dropped to 19,000. There is not much research or articles on U.S. students studying abroad in Japan. There are many opportunities for students to take, but it does not seem that many of them take the chance to go to Japan. Studying abroad in Japan is great, but another thing they are very proud of is their very impressive healthcare system. The Japanese medical system is that all citizens are covered with medical insurance. The only crisis Japan could come in contact with would be the population and demand that comes with healthcare. The Japanese go to the doctors much more than Americans because of the insurance they have due to the impressive healthcare system they have. Patients do not have to make appointments. They can walk in and be treated right away. No matter their race or job, they can be treated at any time they need it. How do healthcare providers make money even though the healthcare is so cheap? Japan has the longest life expectancy, great health, and no waiting in lines or expenses for service. Because of all of these great benefits, you would think that the doctors would make little money. Most Japanese healthcare providers do not make near as much as an American doctor. When looking up how much money a healthcare provider in Japan makes, I came across this article. According to the article I found on the website National Public Radio, T.R. Reid interviewed a Japanese doctor about how much money he makes. Dr. Kono stated that if someone comes in with a cut less than 6 square inches, he would get 450 yen, which would be equivalent to about $4.30 to sew it up. This is a very significant difference in pay than in America. Because of the low pay for services, Japanese doctors have to make money in other ways. Some doctors have vending machines in their office to make money or charge people for parking outside of their office. The downside of this is because the hospitals in Japan are cheap and don't charge citizens much for their services, the hospitals are going into financial debt. This is starting to become an issue in Japan, and not many people know how to fix this issue. This could be something that could really hurt their healthcare system and could mean that citizens might start to be charged higher prices for healthcare systems. The Japanese citizens take their healthcare very seriously, and Americans should take as much consideration for their people as much as the Japanese do. Studying abroad in Japan could be a task that we should encourage our students to experience. It can shape them into a well-rounded student. The healthcare system in Japan affects the business system because the amount of money that the doctors make could be increased if the system was improved. Overall, Japan is very different from the United States, but we could use ideas that could help us with our business and healthcare to improve our healthcare system.
Bravo, bravo.